This is a civil defense message. This is a COVID-19 informational update for Monday, June 29th. On today's update of COVID-19, the number of active cases monitored by the Department of Health on Hawaii Island is 3. An active case is defined as an individual who has tested positive for the COVID-19 virus and is presently monitored by the Department of Health. At this date, no one is hospitalized for Hawaii Island. The one increase from yesterday has been identified as travel-related from the mainland and was under the mandatory 14-day travel quarantine. This individual now will be under an extended quarantine and monitored by the Department of Health. The majority of states are now experiencing an increase of huge numbers of people being infected by the coronavirus. This is causing them to take steps backwards in the opening of activities such as beaches and bars. Hawaii remains in a good place because of your following preventive measures. We must continue and even get better in following the preventive measures to keep Hawaii safe. Thank you for listening, and thank you for doing your part to keep Hawaii safe. This is your Hawaii County Civil Defense Agency.
Hello everybody, Josh here. 2 new cases today. That takes us to 900. It was a wild weekend. We went 17, then 6, then 27, then 2, but just 2. Keep in mind those 17 of those people were from one single event. It was a funeral. We've only had 2 fatalities in the last 2 months, lowest mortality rate in the US. And keep also in mind that 81% of all fatalities are in population of people older than 65 years. Very important we protect our kupuna. Total number tested now is at 77,743. That's up 588. And I would remind you that our ICU beds and ventilators are great. Our goal, 100 tests for every positive case keeps us safe. 10,000 tests per day available, that would be ideal. We have to ramp up further. 500 tracers will also really protect us a lot. And as we see travelers come back to Hawaii, we want to see no spread. That's why the pre-test. Stay safe, wear your mask. Aloha.
One of the things people I'm sure have been worried about is the fact that we've seen some increases in the number of cases on a week-over-week basis. We actually last week had in the early part of the week, it went down and then it came back up. And I think it's hard to know exactly what that means without knowing specifically where those cases are. That is, if they're all tied to a cluster or if they're really, truly just random. Most places view an increasing number of cases as worrisome, either if you're getting close to meeting the capacity of your healthcare system, which I know Ray Vara's on, and he will confirm that we are not even close to that. So that's not a worry. And the second is maybe what a lot of other places do is they look at consecutive weeks of doubling, which we also have not had. So I guess what I would say is it's too early to push a panic button about the increasing number of cases. Obviously, we expected an increase in cases and we should continue to watch it, but it's not anything to panic about at this point. Ray, I don't know if you wanted to comment on hospital capacity at this point.
Yeah, this is Ray. I'd agree with Dr. Mogishi. We are still well within the abilities of the existing healthcare system. We are going to be releasing a new model today that shows how that looks today, as well as how it plays out as we think about launching a pre-travel testing program. And so we'll share some of that information with this committee probably later this afternoon. We'll be sending that out. And as it relates to the increased activity, I think we just need to continually remind the community what each individual's responsibilities are around socially distancing, around gathering in groups, around wearing face masks, around appropriate hand hygiene, and further just continuing to remind people to, if they're sick, to stay home. And all these things are not only to keep themselves safe, but also keep others in the community safe. And if you look at, I think, some of the more recent activity, it's clearly as a result of maybe some of us getting a little bit relaxed in some of those areas. So I would just continue to reinforce that while the state has a responsibility to have a plan that is executable around screening, testing, contact tracing and quarantining, we as citizens have responsibilities as well. And so please just continue to encourage people to do that.